Well, good morning, everybody, again. My name is Councilmember Gabe Albornoz, and I have the distinct honor and privilege of serving along my colleagues, Councilmember Craig Rice and Councilmember Evan Glass, on the Health and Human Services Subcommittee of the County Council. And yesterday, we celebrated Mental Health Awareness Month and acknowledged that this is a growing challenge across our entire country that impacts all of our socioeconomic groups, but also our multicultural groups as well. And we are extraordinarily fortunate in Montgomery County to have developed a very unique initiative to ensure that we provide a stronger bridge between our county government and, in particular, our multi-ethnic and multicultural communities. And so our minority health initiatives have been doing an outstanding job for well over a decade, extending the reach of county government to be able to devise partnerships and alliances and build trust within communities. And so I am honored this morning to acknowledge two very important initiatives carried forward by the Asian Health Initiative to really bring light to mental health challenges, the unique mental health challenges facing our Asian community here in Montgomery County, which is growing rapidly. And we are so fortunate that so many members of our Asian community have decided to make Montgomery County home because they have come for the same reasons that my family immigrated here to Montgomery County in the 1960s. And so we want to carry forward a partnership and alliance with these important initiatives. And so I'd like to welcome somebody to speak on behalf of the entire group to talk a little bit about these initiatives briefly, and then I will read a proclamation. So if you could please introduce yourself and some of the people here present.
Right. Thank you, Councilmember Albornoz. My name is Nguyen. I am the chair of the Asian American Health Initiative Steering Committee. So it's our honor to be here, and on behalf of my colleagues and also our partners from different agencies, thank you for your support, and also for Councilmember Rice and Evan Glass on the HHS committee. So, as you have recognized that the Asian American community have growing population in the county, a lot of time we are mistaken to be a model minority, that we are great, we have no need. But actually we do have a lot of need and challenges. And mental health is a big challenge that we encounter, especially for our vulnerable population is women and seniors, and also the youth. So a lot of Asian youth has suffered from these issues. So starting in 2015, Asian American Health Initiative have started with the photo novel, which is an innovative approach to use a cultural and language relevant material to help educate our community on these special issues. So some of this you can see here. This is the 5th iteration of this work. Because with this, we start focus on the issue of social connections, the care for the guide for caregivers, because we realize the importance of supporting the caregiver and the challenges that they encounter. So I want to take this opportunity to thank the mental health ambassadors. Those are experts, and also they are the people who live through the experience, who have helped contribute to the development of this guide, and also volunteer from our community who have support and give our input and feedback so that we can have this guide made. So we have this photo novel in 5 different languages. We have it in Chinese, Korean, Vietnamese, Hindi, and English. But AAHI have developed a platform that can be translated this material in many other languages. So if you have the need in your community, contact the office. We can help to work with you to translate to other material. So at the end, if you pick up some of this information, and if we have a few books that you can see, if you see the language that you cannot understand, please understand how those immigrants first come here. And the services, when they come to the government office to pick up the material, that's how they feel. So I hope that through this experience, we can continue to work together with you to deliver the material and also the education needed to support our community better. So thank you. And if I may have a few minutes to invite our colleague, Dr. Victoria Chau from SAMHSA, to say a few words.
Hello, everyone. I'm representing the Substance Abuse and Mental Health Services Administration in the U.S. Department of Health and Human Services. we partnered with AAHI with a leadership of Perry Chan here, and also with the Asian Pacific American Officers Committee to create the Healthy Mind Initiative. This is an initiative that focuses on raising mental health awareness for Asian American and Pacific Islander youth. And SAMHSA provided the support in developing a presentation that the Asian Pacific American officers outreached into the community to provide this presentation, and we have been very honored to participate in this partnership and are thankful for them. So I'd like Karen Chaves, who is part of APOC, to share a few words.
Hi, good morning, everyone. It is our privilege to serve in the U.S. Public Health Service Commission Corps, and it's been an honor to work with AHI and SAMHSA in this partnership for Healthy Minds Initiative. We couldn't have done it without the support and the training that AHI has provided to our officers. So we thank everyone for their leadership and support. Thank you.
Thank you very much. Now we will read the proclamation. You can just hold it. Thank you so much. Great. All right. The County Council of Montgomery County hereby provides the following proclamation. Whereas, as the Asian population in Montgomery County has nearly doubled in the past 2 decades to over 160,000 people, the older Asian American adult population has also grown to become the largest minority senior subgroup in the county, constituting 15% of the senior population. And whereas the Asian American communities face unique mental health challenges and barriers to accessing care, such as cultural misconceptions and stigma about mental health, limited use of mental health services, and a lack of culturally and linguistically responsive mental health programs, services, and providers. And whereas, in response, the Asian American Health Initiative is actively tackling the mental health needs of the Asian American community through innovative and powerful community-centered strategies rooted in community engagement, community empowerment, capacity building, and systems improvement. And whereas, with the support of their steering committee, mental health ambassadors, patient navigators, and community volunteers, AAHI has developed a unique educational tool, the 5th installment of their photo novel project entitled Social Connections, a resource for caregivers, to raise awareness and foster dialogue about social isolation and loneliness among Asian American seniors. And whereas AAHI, in collaboration with the Asian Pacific American Officers Committee of the United States Public Health Service Commission Corps and the Substance Abuse and Mental Health Services Administration, established the Healthy Mind Initiative, which aims to improve mental health literacy, stigma, and cultural behaviors in Asian American communities. Now there be resolved that the County Council of Montgomery County, Maryland, hereby congratulates all partners involved with the development of Photo Novel 5 and the Healthy Mind Initiative, presented today, the 14th day of May in the year 2019, signed by myself and Council President Nancy Navarro. So why don't we take a picture together, and if you can give these great folks a round of applause.